this is the home screen. So this is where you end up when you log into the app. As I said before, this is on a computer, but this looks exactly the same if you log into to it on a mobile device. So here you have shortcuts to what we call the live translation feature. You have some other features here, very prominent on the home screen. Here we have some examples for these lists, dialogue lists that we have talked about. And I thought I will start with showing you the live translation feature. So here you have the dynamic conversations where you just can press the microphone and speak into the device. Hi, how are you feeling today?
Hi, 今天感觉怎么样?
So this was now Chinese Mandarin. So here is where you change the patient language. Now I don't read Chinese, so I don't know if this was correct. Therefore, we have a live translation feature, which is these arrows down here. So I press them and then I see what was translated. So here you see actually that it was a correct translation. I can also change the language here. So here I can put in, maybe we'll do Russian. And then for Russian, there is, of course, nuances to the language, whether it's a male or female. So I'll choose a female. And then
Как ты сегодня себя чувствуешь?
The same sentence is then displayed in Russian. And here I can then say something else. Do you feel hot?
Ты чувствуешь жар?
And then I can, again, I don't read Russian either, so I will check the reverse translation. And here you can see that there is a discrepancy. So, do you feel hot? I was asking, do you feel feverish? But the translation became, do you feel the heat? So here the context is actually wrong. So, and this is machine translation, so this can happen. Machine translation will never be 100%. So here it's important for the staff to know that there is a context switch here. So here, if I'm a staff, I have to then rephrase. Do you have a fever?
У вас есть температура?
And now what happened was, do you have a fever is a medical phrase stored in our medical phrase library. So here you can see that the blue box came up, which is a verified translation. So here I don't have to worry about any reverse translations. As Sarah said before, I can trust that this is the right, whatever comes out in Russian is the correct context for do you have a fever. So, and then of course, if I spoke Russian, I can use the blue microphone to speak back in Russian. And then if I hit the home screen, we're back where we started, where we then have also the dialogue lists. So here I've now got lists suitable for elderly care. I can look at, for example, this one called examination. And the big difference here is that I don't have to speak into the device. This is one of the lists that Sarah and her team created for palliative care. So here, this is now a list in the context of elderly care where you say, you can just press play. You don't have to speak into the device. So you press play.
Можно вас обследовать?
So this was may I examine you, and here the patient can also respond straight into the app, yes, no, I don't know, or speak freely using the microphone. You can then just go down the list and say, please move to the examination table. Here,
Пожалуйста, переместитесь на диагностический стол.
And here you also have an image to further enhance the conversation that you're trying to make. You can also, of course, always change the language. And here we also have a new feature, which is detect language. I mean, this is not very common. You end up in a situation where you have a patient and you don't know what language they speak, and they cannot either show you in the list. But here you have a detect language that you can, if a patient comes in, speaks a language that you don't know, you can use this feature just by pressing the microphone and let them speak. Nu talar jag svenska. Hör du det? So here I spoke Swedish and it correctly said that this was probably Swedish. So this is how you can also use the detect language feature if you don't know what language the patient is speaking. So here I've now quickly shown you both the lists, how you can use them, but also how you can use the live translation feature.